Hello friends, I am Dr. Sunny Google. I am an orthopedic surgeon, sports medicine specialist and a robotic joint replacement surgeon. I am practicing here since last 15 years at my Happy Joints clinic in Pune Swargate area. As a knee surgeon, I oftenly see patients with knee injuries. I oftenly see patients with knee osteoarthritis and with multiple knee problems. But nowadays, there is an increasing trend of people of middle age coming at the age of 30 to 40 and having their knee problems. Why there is a sudden surge of these problems? All of a sudden, we have started realizing that after the COVID era, people have started realizing fitness is very important. As fitness is important, people have started involving into sports activities. Because of these, there are repeated sports injuries happening around the knee joint. These, when not treated well or when neglected, leads to a lot of knee problems and knee issues. So, my dear friends, today here I am going to give you tips on how to avoid knee injuries and knee problems at middle age and what care can be taken at this age to avoid knee problems in future. Because of your sudden and aggressive lifestyle or lot of aggressive activities in the day-to-day life, we tend to forget to take care of our knee joints because these are the highly used joints in our body, like our hand joints, our hip joints, our lower back joints. Because of these joints are more exposed and more prone to have repeated knee injuries and repeated problems. So here we need to look into a lot of issues that can be taken care of, a lot of tips and tricks that can be followed in your middle age to avoid knee problems in future. We oftenly see patients whose relatives are getting operated for knee osteoarthritis, auntie, uncle, grandmother, grandfather, and these young people are always more worried about what care they have to take in their young age so that they don't reach the advanced knee problem stage where they would need a knee replacement surgery in future. So friends, this is a very important topic and I am going to give you small tips to be followed in order to take care of your knees at a younger age so that you can avoid problems in future. Most important parameter what we tend to forget and neglect is what is healthy weight. I want all of you to do a small exercise. Please weigh yourself in kgs, measure your height in meters, and you have to do a small calculation of weight in kgs divided by height in meter square, and that will give you a figure known as BMI or body mass index. This BMI is very important because if someone at a height of 5 feet is weighing 70 kgs and if someone at a height of 6.2 feet is weighing 70 kgs, the fitness and the BMI is going to vary. So your body weight should be as proportionate to your body height. If this magic figure comes out more than 25, you need to be alert. If this comes more than 28, you need to be alarmed. And if it comes more than 30, then you should be definitely worried about because you're calling yourself into a obese or overweight category. Healthy weight is very important for keeping your joints healthy because this unnecessary extra weight which your body has to carry takes a big toll on your joints, takes a big toll on your lower back and is going to cause a lot of issues in the future. If you are slightly overweight, doesn't make a difference, but if you're grossly overweight, then you need to be careful. Follow good eating habits and control your weight. That's a small tip that I can give you. Regular low impact exercises like brisk walk, static cycling, everyday walking for 30 minutes, doing low aerobic impact exercises is very, very important. Skipping, jogging, jumping, running. But these are to be done on regular basis. We see a lot of people doing a lot of these type of exercises at a weekend. The whole week they don't do anything and then at a weekend they suddenly do a lot of exercises and then they get a lot of sprain and strain injuries around the knee joint. So a regular low impact exercise is very important for keeping your joints very healthy. Strengthening of your leg muscles, not just flexibility and mobility, but strength is very important because on an average every individual walks around 5,000 to 6,000 steps every day. So your knee joint is being used 5,000 to 6,000 times every day, and just imagine the load that is coming on it. If you don't have adequate strength, then this knee joint is exposed to a lot of strain and strenuous activities which are going to cause a lot of repeated injuries to the knee joint. Identify yourself in these areas and work on it. Stretching and yoga. Our dear Prime Minister has popularized World Health Yoga Day and we all need to be aware of it. We all need to start doing some amount of yoga exercises, because that leads to stretching of your ligaments around the knee joint, that improves vascularity, that improves good blood flow to your joints and keeps your joint healthy. We invest in a good smartphone, we invest in a lot of good cars, we invest in a lot of other accessories, but dear friends, take care of your footwear. A good footwear is very important to give you a good posture during standing, during walking, during climbing. If you're not having a good footwear, all the pressure coming from your foot is going to be transmitted to your knee joint and is going to cause a lot of problems in your knee joint. Good ergonomics at work is very important, because if you're not sitting properly, if your sitting posture is wrong, if you're standing a long period of time, if you're sitting at the same place for a long period of time, then again you're going to expose your knee joint to have a lot of strenuous activities when you change your posture and you change your activity, and that can also lead to knee problems in future. Proper supplements is very important, as we all know that in spite of eating so much of food, we don't get good nutrition, or we don't get good vitamins, good minerals and good proteins in our diet. So we need to be careful and be aware of our deficiencies and take proper supplements. If you're deficient in calcium and vitamin D, you need to supplement it. If you're deficient in vitamin B12, you need to supplement it. If your protein intake is very poor, especially in those having vegetarian diets, the protein intake is very low. It is not even meets 50% of your daily dietary requirement, and these people need to take supplements on a routine basis and maintain their proteins and minerals at a normal level. Certain habits like smoking and alcohol will also lead to a lot of joint issues. The smoking and alcohol will lead to narrowing of our blood vessels and lead to less blood flow to the knee joint, hence delaying the healing process around the knee injuries, and hence the causing a lot of trouble to the knee cartilage and the knee joints, causing issues in the future. Again, you need to identify yourself in a certain age group for having heredity issues. So if your auntie, your uncle, if your first blood related relations are having knee problems, then you are at a certainly little more risk to have these problems in the future. So if you are having such patients in your family, then not be scared of, but be a little more aware of these problems and start taking care of your knees at a little younger age, so that you can avoid these problems in future. So my dear friends, these were the small tips that I wanted to share with you all, so that you are not worried about your knee getting damaged in the future, and you can take right care of your knee joint right away. If you have any such questions, any doubts, any queries, and you want to connect to me, please comment in my comment box and ask questions. I will try to answer them in my future videos. In order to be in touch with me on a routine basis, please subscribe to my channel and click on the bell icon for regular updates. Thank you.